Why does your low back mostly hurt first thing in the morning? Hey guys, my name is Dr. Grant Elliott with RehabFix, and the reason why is because of a little something called imbibition, which essentially means an intake of fluid or a swelling of fluid within this disc in this example. So as you're walking around throughout the day, there's a certain amount of compression occurring on the spine, and as we get this compression throughout the day from gravity, mostly walking around, right, these discs, they compress, they get a little bit smaller because they're losing fluid throughout the day from that compression. So at the end of the day, when we lay down to go to bed, all of these discs right here have a second to take a cool drink of water and swell up a little bit. It's just like we get our water bottle and we're filling these discs up, we're rehydrating them to make them nice and healthy again. But when we go to stand back up first thing in the morning and we get that compression again, they can be extra sensitive because those discs are swelled up with fluid. So it's like this. Imagine you had a water balloon, okay, and you pumped that water balloon up with water. You filled it up a bunch, but that water balloon had a little crack in it, had a little hole in it. The amount of fluid that's flying out of that balloon or the amount of pressure on that sensitive area is going to be heightened after filling that balloon up with water and really filling it up. It's the exact same thing as the discs in your low back. These sensitive areas are going to be exacerbated because of the amount of fluid within them. With this knowledge in mind, now it makes sense. We lay down, the discs swell, we get a little bit taller as we sleep. That's a true statement. We stand back up, that compression returns, and now we have some increased sensitivity within those areas. So a good strategy that you can implement is before you even stand up, while you're still laying in bed, let's try and implement some low back mobility work so that we can get those discs moving, we can get that fluid moving around them, we can get those joints moving, we can get our nerves and muscles moving too, all those good things to reduce the sensitivity within those areas and make them feel a little bit mobile before we even stand up. And then when we get up, we stand and we start our day, we might feel a little bit better doing so. So I hope that was informative. I hope you gained something from that. If you have any additional questions, be sure to leave them in the comment section below. Otherwise, let's keep working hard and let's keep finding ways for us to be empowered so we can learn how to fix our own low back.